Well, in honor of National Wear Red Day, we're raising awareness about the risks of heart disease in both men and women. Heart disease, the #1 killer of both men and women, with 1 in 3 women dying from it annually and 1 in 4 men. Here to talk to us a little more about the risks of heart disease is cardiologist Chippy Nalluri, a cardiologist at the Heart Specialists of Sarasota. Dr. Nalluri, thank you for joining us this morning. We appreciate you coming out. It is pretty early, so thank you for waking up with us.
Absolutely.
So talk to us a little bit about who is most at risk when it comes to heart disease. Kind of a surprising number we were talking about.
Everyone is at risk. You know, heart disease accounts for over 800,000 deaths a year. That accounts for 1 out of every 3 deaths, so a staggering number. Again, in honor of National Wear Red Day, it is a woman's #1 killer. Unfortunately, only 54% of women understand that this is their #1 killer. Significantly lower percentage in Hispanic and African American women's.
Right, and something we mentioned a few minutes ago is that, you know, a lot of women or people in general think breast cancer is the #1 killer of women. Talk to me a little bit about the differences between that.
So 1 in 31 women die of breast cancer, 1 in 3 dies of heart disease. So it's 10 times the killer.
It's amazing. And what are some of the main causes of, I guess, heart health risks and, you know, things people should look out for?
Right. So this is a very important point because so much of heart disease is preventable. So controlling your blood sugar, controlling your blood pressure, controlling your cholesterol, not smoking, eating right, exercising, and management of stress and reducing alcohol. So 90% of heart disease is preventable. These are modifiable risks, which means if you change your lifestyle, you alter the course of this disease.
Wow.
Definitely.
Amazing.
And certainly a busy day for you today. I'm sure you have a lot of stuff lined up to educate people, but
Yes.
what are, if they aren't able to maybe get out and do anything, get to educate about that, talk to me a little bit about what are some good resources for people to look to.
American Heart Association, the Go Red campaign, there is an incredible amount of wealth of data on the internet. Again, it's very simple. Change your lifestyle. Have accountability. Be your own healthcare advocate. Know your numbers. The Go Red for Women task force has always made this point very clear. Know your numbers. Visit your doctor. Be your own healthcare advocate. Talk about your blood pressure, your cholesterol. Stop smoking. This is, again, such a preventable disease.
And should people make cardiologist visits part of their regular annual checkups?
You know, people can start with a primary care physician, and then depending on your level of risks or symptoms, then they come to us.
Excellent.
Awesome. Well,
All right.
Thank you very much for joining us, Dr. Nalluri. We appreciate you taking the time out of your day to educate folks about the Go Red campaign.
And thank you for what you do on the other days as well.
Exactly, exactly.